Thanks for joining us and welcome to today's review of hip flexor strengthening exercises brought to you by posture-exercises.blogspot.com. So the hip flexors are a group of muscles that cross the front of the hip. They include the psoas major, the psoas minor, iliacus, tensor fasciae latae, and rectus femoris. Now, as well as being the muscles that help bend the hip, they are also very important because they can affect the tilt of the pelvis. When most people have a problem with the hip flexors, they think of tightness in these muscles. Now, tightness in these muscles can cause what we call an anterior tilt of the pelvis. That's where the top of the pelvis is tilted forward. So if you put your hands on your pelvic bones and move them in a forward direction, that is anterior tilt. Weakness in these muscles, because these muscles cross the front of the hip and should be preventing it from tilting back, weakness in these muscles can cause a posterior tilt. That's once again where if you had your hands on your pelvis, this time you're tilting them backwards. So just to better illustrate that, a couple of diagrams. The one here on the left shows more an anterior tilt of the pelvis. Notice how that also typically causes a greater arch in the lower back. The one on the right is not a severe posterior tilt, but it's just showing you that you can see that very front bit, if I can get my arrow there, very front bit of the pelvis is a little bit more forward than the top of the pelvis here, and that tends to flatten out the back. Now, when we talk about weakness in these muscles, we're mostly concerned about the iliopsoas, and the iliopsoas is a group name given to the psoas major, psoas minor, and iliacus. They all come together to form a common insertion point into the thigh bone. Now, the iliopsoas is the only hip flexor muscle that's working at the end of range hip flexion, and so that's an important note to remember, and we'll look at that more when we go to strengthen this muscle. Now, just a cautionary note with this one is that these exercises are not for everyone. These are only suitable for people with particular postures that have weakness in these muscles. They often include a flat back posture or a sway back posture, and if you want to learn more about what those postures are, definitely have a look at our website at posture-exercises.blogspot.com. But the other important thing is, because the iliopsoas attaches to the lower back, you need to have good core stabilizations before attempting these exercises. Exercising these muscles can, if you don't have that stabilization, can cause more compression on the lower back and lead to back problems. So very important that you have good core stabilizations. And once again, if you want to learn how to stabilize use those core stabilization muscles, have a look at the website. We've got some great exercises to get you started there. And of course, if any of these exercises give you pain, stop immediately. So let's have a look at method 1. You'll be sitting in a chair, back in a neutral position, so that you're sitting up straight. You're not slouching, but you're not also hyperextending or overarching the back. Use your hands to lift the leg up to as far as the hip can bend. That way that we're making sure that the only muscle that can hold the leg in that position is the iliopsoas, and then let go and try and hold the leg in that position. This is often trickier than you think, and repeat it 10 times. So let's have a look at that one. Very good. Now, method 2 is a progression, and we progress by adding a resistance. The way we add the resistance, it's the exact same method as method 1, but this time we are using our hands to gently push down on the leg to add some resistance. Once again, hold for 10 seconds, repeat 10 times. So let's have a look at that one. And there you go, some exercises for strengthening the hip flexors. For more posture tips and exercises, please visit us at posture-exercises.blogspot.com. Thank you.